I'm really excited right now to welcome Dr. Kim Dennis from SunCloud Health. Dr. Kim and I did an event earlier this summer, and it was just an incredible conversation. You're an incredible person, and I'm excited for you to have the opportunity to talk to everybody today.
Awesome. Thank you so much. First of all, I just want to say thank you to Jason and everyone at ANAD and all the partners who made this happen, and say how delighted I am about being asked to come here. It's an honor and it's a privilege, and I don't take it lightly. I'm grateful today to be alive, and this Vigil and ANAD as an organization hold a very dear spot in my heart. It's really important to me as a human being and as a person with lived experience who's recovered from bulimia, trauma, and alcohol use disorder, food addiction, to be able to share my story as a professional. You know, I'm a doctor. I've made it through medical school. I was saved, and I've had the experience, and I've been in the field for the last 20 years, so I know that different people have different needs, and we know only a little. You know, here's the secret. Like, if any doctor sits across from you and is an eating disorder doctor and says, like, I know your answer, and it's this because this worked for everyone, run for the hills, you know? Because we know only a little, and our treatments work for a lot of people, but they certainly don't work for everybody. And it's not because the person on the other side of the table isn't trying or comes from a bad family or whatever, you know, however it gets spelled. So I carry with me today two people with the initials JS who live in my heart, who didn't make it out of the disease. And they're part of me, their families are part of me. And the unity that we find in ANAD, the belonging that I've found in ANAD, is something that I don't find in all eating disorder spaces. So I'll tell you a little bit about, my journey. I grew up food insecure on food stamps and with a lot of violence in my family and active addiction in the home, and didn't really experience an eating disorder until I got to college, my first year of college. And, you know, when I look back at things that I didn't even know were traumas, you know, how I coped with those things was, you know, by thriving, excelling academically and playing sports. And I was, you know, naturally talented in those things, which I'm very grateful for. And, you know, so when I came to college, I was ill-equipped to sort of cope with life and life as an adult. And, you know, then began my eating disorder, you know, and it's something that for me sort of took off and eventually became a thing that I couldn't control. You know, it was ruling me, and it was as if I was possessed by something else, you know. And I had a hard time finding help. I didn't have access because I was on student insurance, and back in the day, you know, there weren't student counseling centers that knew anything about eating disorders. So there were therapists that I tried to work with that actually ended up doing more harm than good, not because they're bad people, but just because they didn't know, you know. And there were eating disorder therapists who also did more harm than good, again, not because they're bad people, but because our evidence-based treatment approaches don't work for everyone, you know. And our evidence base is based on predominantly restrictive type eating disorders in white humans, white women, you know, girls and women. And eating disorders come in all different shapes, sizes, colors. People come to treatment with different life experiences, both systemically and as individuals. And everybody really, I believe, has their own unique journey and needs different things. So when I think about how, and I often do, you know, every day I wake up and I kind of still can't believe that I'm alive, and I've been recovered for 24 years, something crazy. And when I think about, coming to this event, what it means to me to be able to stand up here as an MD, as a psychiatrist, who's had the great privilege to be entrusted to help many, many, many people and their families. It's a profound experience, and I think about, well, what saved me? A lot of what saved me was what I refer to as God with skin, and first and foremost, among those people would be a man named Bill Waldner, who was an LCPC and a CADC, who was one of the first people I sat across who saw me, and who actually listened to my voice and didn't hand down a treatment to me that said, well, you have to do this, 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 and this. The man gave me plenty of recommendations, many of which I said, absolutely not, but in much more colorful language. And he stayed with me, and we found ways that actually made sense to me, that worked with my body and my nutritional needs, and connected me to a lot of people who loved me and supported me back to life. And those people were not treatment professionals. They were peers in recovery in my community that I can go to support groups with, that was peer-led by people just like me. I could leave the med student doctor part of myself outside the door and just be me and say whatever was going on. And I was always, always met with, don't stop fighting. We know you're gonna get better. We know this is gonna get better. And we love you and we care about you. Call me anytime, night or day. And I needed that kind of safety, and it took a long time to build up trust, both for professionals and other people. And something saved me. That was a big part of it. All the people who didn't have degrees after their names, who had recoveries that looked different ways, whether they were struggling or whether they had been recovered for 20 years, each and every one of them helped me along the way. And I spend a great deal of my time, while I'm not doctoring and not taking care of my kids today, giving back to that community. And I still go, not because I struggle with body image or eating, or, I have freedom of choice today around what I eat, when I eat, which is another miracle. But I go back because it fills me up on a soul level, to be able to talk with people and guide them along and give back some of what I've been given, And recovery becomes about, for me anyways, recovery isn't about food or body, or using alcohol or not using alcohol. It's about freedom and living my life, navigating relationships with other people, whether they're professionals or people in my family or friends who sometimes, in my opinion, behave well and sometimes don't. And growing spiritually, I was, despite all of the stuff that I experienced as a kid, I was raised in a household that believed in God, at least by word. And I found comfort in that even as a kid when terrible things were happening. And I lost track of that. I lost connection with that. And that was a really key part of my recovery. How often do you see in evidence-based eating disorder journals make sure you include spirituality? It's just not in there. So, part of my message to anybody who's here, anybody who's lost anybody to an eating disorder, anybody who's struggling with it, is you keep fighting for you, and fight until you find your people, and be open to where they might be. They might not be in the traditional places. Many, many, many people in this country have eating disorders. A tiny fraction come to treatment centers, like the one that I run, And when they do, oftentimes they're met with dogmatic care, right? Well, if you have an eating disorder, you have to eat a meal plan that has this nutritional philosophy. One of the nutritional philosophies that worked for a lot of people, most people I would even say that I've treated, is all foods fit. in moderation and getting people back connected to their intuition. And for most people, that is a long journey. And many people, particularly Black people, brown people, gender minorities, marginalized, people who are economically disadvantaged, they don't have the access, and they haven't been in safe enough environments to be able to do the things we're asking them to do on the eating front, So I needed somebody who could look at me as a whole human, who could look at my whole history, and who could treat me with compassion and love and patience, hope and faith. And by some stroke of luck, that's what I got. I had a family around me. I had a mom, may she rest in peace, who cooked for me, and made my food environment a safe place for me to start nourishing myself again. I had much older siblings who paid for me to go to therapy. I had all those peers in recovery, and I made it through medical school, graduated medical school, not experiencing an eating disorder. Made it through residency, decided against somewhat of my better judgment, you know what, I think it's not only okay and safe, but good for me to treat eating disorders. And I love it. I love people with eating disorders, and especially when there's 5 other things embroiled in it. That's the kind of patient that I love working with. I met my husband in recovery, who adores me, sometimes to ridiculous amounts. And I raised 2 stepkids. I couldn't even feed myself, you guys. And had a child from this body. This body made a child, and then fed that child for 2 years. And started 2 treatment centers. The one I run right now is SunCloud Health, which my husband and I co-founded. And, I pound the pavement, and I'm going to keep pounding the pavement as an eating disorder professional who has not always felt welcome in the field and who has not always felt like I belong in the field, that we must do better. We must broaden and include everybody's voice. My needs are different as a person with co-occurring, addiction and food addiction and trauma than somebody who has different sets of other things, And when we start treating people like human beings, magic happens, And one of the organizations that I've always experienced in that way, that's been brave enough to, for example, let me write a blog and let me use my own language, and not censor it, has been ANAD. And I'm very grateful for that. So my life today is full of life everywhere, including the people that I'm entrusted to care for. And I spend a lot of time training staff on how to treat people as humans in an individualized way. And that one person's meal plan might look completely different than another person's. What works for one person might be different than another person. And how to do that in a setting where different people have different needs and, focused on unity. We're all in this together. And that's something I'm very passionate about. And I study things, I get to do a research project and study different nutritional philosophies and actually see how it works for different people, And I think as a field, the more we step away from saying it's either this or that, that black and white thinking that we're always trying to help our patients with, that rigidity that we're always trying to help our patients with, shows up a lot in the field. And we have some work to do, and I'm grateful for my colleagues here who are like-minded and are pushing the boundary forward, because people are out there dying. We know that. We see that. And I'm going to keep fighting for all of those people who are poorly served in treatment, who don't even have access to treatment. Hopefully, like the song said, well into my 90s. So thank you.